Irreversible non-selective monoamine oxidase, or MAO inhibitors, are one of 3 MAO inhibitors available. The other 2 are reversible inhibitors of monoamine oxidase A, known as RIMAs, and selective monoamine oxidase B inhibitors. If you want to learn more about these other 2 MAO inhibitors, click the link on screen or in the description below. Irreversible non-selective MAO inhibitors inhibit both types of monoamine oxidase, or MAO enzymes, MAO-A and MAO-B. These enzymes are located in presynaptic nerve terminals within the central and peripheral nervous systems. Both types of MAO enzymes inactivate monoamine neurotransmitters, such as serotonin, norepinephrine, and dopamine. However, while MAO-A enzymes inactivate all 3 monoamine neurotransmitters, MAO-B enzymes only inactivate dopamine. Irreversible non-selective MAO inhibitors bind to both MAO enzymes, inhibiting their actions irreversibly. This means they create a permanent bond and permanently inhibit the action of the MAO enzyme to which they are bound. As a result, fewer reabsorbed monoamine neurotransmitters become inactive and instead accumulate in the synaptic vesicles within the presynaptic neuron. When the neuron is next stimulated, these neurotransmitters are released into the synaptic cleft, or the space between neighboring neurons, or a neuron and its target tissue, causing an influx. As a result, the effects of the neurotransmitters on their target neuron or tissue are increased. In the peripheral nervous system, there's mainly an influx of norepinephrine in the synaptic cleft, which acts on the adrenergic system. Norepinephrine binds to and stimulates alpha and beta adrenergic receptors. The most noteworthy effects are alpha-1 receptor stimulation, causing vasoconstriction, and beta-1 receptor stimulation causing a positive inotropic and chronotropic effect, meaning the heart's force of contraction and rate increase. Both of these lead to an increase in blood pressure. Due to this action on the adrenergic system, irreversible non-selective MAO inhibitors are considered indirect adrenergic agonists. However, irreversible non-selective MAO inhibitors are not used for their effects on the peripheral nervous system. Instead, irreversible non-selective MAO inhibitors are used for their effects on the central nervous system. Increased serotonin, norepinephrine, and dopamine levels in the central nervous system improves mood and enhances alertness, focus, and motivation. Irreversible non-selective MAO inhibitors include Isocarboxazid, Phenelzine, and Tranylcypromine. Irreversible non-selective MAO inhibitors are used to treat treatment-resistant depression when other antidepressants have failed. The reason they are not a first line of treatment is due to their significant drug-to-food and drug-to-drug interactions, which can lead to dangerous adverse effects. Adverse effects of irreversible non-selective MAO inhibitors include insomnia, orthostatic hypotension, edema, constipation, nausea, dry mouth, dizziness, fatigue, headache, tremor, weakness, weight gain, hypertensive crisis, seizures, and hepatotoxicity. Irreversible non-selective MAO inhibitors are contraindicated in patients with liver, severe renal, cerebrovascular, and cardiovascular disease, uncontrolled hypertension, severe or frequent headaches, and pheochromocytoma, an adrenal gland tumor that can cause dangerously high blood pressure. When receiving treatment with an irreversible non-selective MAO inhibitor, it is essential to assess blood pressure, pulse, and orthostatic vitals frequently. Measuring orthostatic vitals involves measuring blood pressure and pulse first while lying down, and then again after standing for 1 to 2 minutes. If orthostatic hypotension is a concern, changing position slowly can minimize it. It is also important to assess mental status, including mood, anxiety, and suicidal tendencies, especially in early therapy. Suicidal thoughts may intensify initially due to changes in neurotransmitter levels before the medication's full effects, which typically take 3 to 6 weeks. Additionally, fluid balance and weight should be assessed for fluid retention, and blood work to measure liver function tests may be required to monitor and assess for hepatotoxicity. To prevent insomnia, taking this medication in the morning is recommended, and when possible, this medication should be discontinued for at least 2 weeks before undergoing general anesthesia. Irreversible non-selective MAO inhibitors should also not be stopped abruptly, as this can lead to withdrawal symptoms. Toxicity and overdose can also occur and are characterized by the previously mentioned adverse effects, as well as respiratory distress, vascular collapse, hallucinations, fever, chest pain or discomfort, lockjaw, and diaphoresis. Treatment involves inducing vomiting and gastric lavage if ingested recently. Otherwise, treatment is supportive as symptoms arise. Irreversible non-selective MAO inhibitors have many food interactions due to the presence of MAO-A enzymes in the liver and intestinal wall. These MAO enzymes break down tyramine, an amino acid in many foods. However, irreversible non-selective MAO inhibitors inhibit this action, which causes tyramine levels to increase. This is a concern because tyramine can trigger the release of norepinephrine, which can result in a hypertensive crisis, and a hypertensive crisis can lead to stroke or even death. As a result, foods rich in tyramine should be avoided while on an irreversible non-selective MAO inhibitor. Unfortunately, many foods contain high levels of tyramine, such as aged cheese, cured, smoked, or processed meats, such as ham, fermented or pickled products, such as soy sauce and pickled cucumbers, some alcoholic beverages, such as red wine and beer, yeast extracts, such as Vegemite, and dried, citrus, tropical, or overripe fruit. Irreversible non-selective MAO inhibitors have many serious drug interactions. Therefore, it is crucial to consult a healthcare professional before taking any medications, including prescription drugs, over-the-counter products, and herbal supplements. For instance, these inhibitors should not be combined with any other antidepressants, such as selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, or atypical antidepressants. Doing so can lead to a hypertensive crisis, and in cases involving serotonergic antidepressants, it can lead to serotonin syndrome. Therefore, if switching antidepressants, at least a 2-week break is generally required before starting the new one. This is necessary because the irreversible nature of these medications means that new MAO enzymes must be synthesized for their effects to diminish. Additionally, a hypertensive crisis can arise if these inhibitors are used with sympathomimetic drugs, such as amphetamines, a central nervous system stimulant, norepinephrine, a vasopressor, and pseudoephedrine, a nasal decongestant. I hope you found this video helpful. If you did, please let me know by giving it a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!